Next, Dr. Jake Barrelet will talk about our innovation mission and how we are supporting our clinical innovators here at McGill.
Hello and welcome to the Steinberg Center Simnovation Hub. My role is to ensure that the principles and practice of the innovation cycle are fully integrated throughout the Faculty of Medicine and Health Sciences. Our goal is to provide McGill students and faculty with the physical and cultural environment to transform their ideas into concrete, viable solutions to meet today's pressing healthcare needs. We're forging partnerships with computer scientists, business leaders, engineers and industry to promote cross-fertilization and to leverage existing expertise and resources. Our virtual hospital environment offers a unique laboratory in which to understand clinical needs, test ideas and technologies and establish necessary proofs of concept for evolving medical technologies. We offer opportunities to collaborate with clinicians and use our facilities at the innovation lab, such as 3D printers, our robotic arm, and we work with startups and industry partners to help bring to market medical devices and other innovations to improve healthcare. We recently supported student startup AI Fred when they tested their software here. This promising McGill-based startup has created a clinical decision aid for family doctors and psychiatrists who are treating depression. Similarly, we assisted Fem Therapeutics, who are based here, develop their prototypes using clinical samples and expertise. We also ran a graduate clinical innovation program at McGill in collaboration with Concordia University and the École de Technologie Supérieure as part of the CREATE program, supported financially by the Natural Sciences and Engineering Research Council of Canada, or NSERC. This innovative program brings together multidisciplinary teams of graduate students with backgrounds in surgery, health, engineering, computer science and business to foster innovation in healthcare and to accelerate the development of innovative medical technologies. Many of the past graduates have continued to develop these concepts and are currently in various stages of execution. The McGill Clinical Innovation Competition, or CLIC as we call it, is another important initiative that we have established with our McGill alumnus Dr. Ray Hakim in 2018. This competition aims to inspire and support members of the Faculty of Medicine and Health Sciences community to conceive and develop promising ideas that can have a direct and positive impact on Canadian and global healthcare. I'm happy to report that in spite of the challenges brought on by the COVID pandemic, innovation is still being actively pursued at McGill. We recently celebrated our third annual Clinical Innovation Competition in virtual format with great results.
Thanks, Jake. We look forward to seeing what the future holds for these creative innovators.